Doyne honeycomb retinal dystrophy, also known as autosomal dominant radial drusen, is a macular disease characterized by small white drusen at the posterior pole. It usually first presents in the third decade of life and slowly progresses as the number of drusen increase, they enlarge, they coalesce, and can eventually form a plaque that looks a lot like geographic atrophy and AMD. This involves a point mutation on chromosome 2 involving the gene EFEMP1, which I'll show you a picture of now. That mutation is the culprit of Doyne's. Doyne's, depending on if it was inherited homozygously or heterozygously, can have different effects on different individuals. This can involve variable visual acuities, variable color vision, metaphorphopsia, and can make the disease progress to a point in some patients where they develop choroidal neovascularization, much like an AMD. Next, I'll show you 3 pictures that show the progression of a person with 20/20 vision all the way to counting fingers. Okay, that was a joke. This has nothing to do with bees or honeycombs. Make sure to note the drusen around the optic disc. So you probably noticed that that last picture looked a lot like geographic atrophy and AMD. Not every case is going to get that severe. Next, I'm going to show you the progression of someone's disease over 14 years that is not quite as severe. If someone presented with drusen of this fashion in clinic, you could run an ERG on them. The results would most likely be normal. You could send them for genetic testing, in which case they take a blood sample and sequence the entire genome and look for that point mutation. You could also run fluorescein angiography. Fluorescein angiography is going to show hyperfluorescent drusen in that radial pattern. There's currently no cure for Doyne's honeycomb. At this point, you're going to continue to monitor the patient and do comprehensive vision exams on them. Anti-VEGF intravitreal injections may be needed if the patient presents with choroidal neovascularization. Eventually, low vision aids and occupational therapy may also be needed. Gene therapy is the best hope for the future, targeting that mutation on the EFEMP1 gene. Any questions?